My name is Fairuz Wendek and I'm going to present about Down syndrome. Humans contain 23 pairs of chromosomes inside the cell's nucleus. Half of them are inherited by each of their parents. Down syndrome is caused when there is an abnormal cell division that results in an extra or partial copy of chromosome 21. It has an overall incidence rate of 1 per 800 births. This mutation affects the human development, intellectual ability, and leads to specific physical traits. Despite the fact that Down syndrome varies in severity, the common features that people with this genetic disorder display include low height, low muscle tone, and a single line across the palm and an upward slant of the eyes. Down syndrome is a disorder that is rarely inherited or passed down within generations. It is caused by a genetic mutation usually occurring during the initial development of the baby. Ultimately, three genetic variations may lead to the cause of this mutation. The first one is translocation Down syndrome, which is the cause of approximately 3% of Down syndrome cases. According to the Mayo Clinic, this form of Down syndrome is caused when only a part of chromosome 21 is translocated to other chromosomes before or during conception. In this case, people have two pairs of chromosomes 21, but have extra genetic material attached to other chromosomes, which leads to Down syndrome. Parents who have a rearranged genetic material from chromosome 21 on other chromosomes are also capable of passing an unbalanced translocation to their kids, which often results in the inheritance of Down syndrome. However, not all children who have Down syndrome due to translocation have inherited this from their parents. Trisomy 21 is the cause of approximately 95% of Down syndrome cases. This is the most common condition that leads to Down syndrome. It is caused by the abnormal cell division after fertilization during the development of the egg or the sperm. In this case, the individual has three full copies of chromosome 21. Lastly, the mosaic Down syndrome. This is a less common cause of Down syndrome. It is caused by the abnormal division after fertilization, in which only some of the cells contain an extra copy of chromosome 21. People with Down syndrome are prone to developing various types of health problems. Approximately 50% of people born with this disorder have some type of congenital heart disorder, which can be very dangerous for them because it may lead to high blood pressure in the lungs, difficulty for the heart to pump blood, and blue-tinted skin due to reduced oxygen levels. People with Down syndrome also encompass a series of digestive problems ranging from structural defects in their organs and system to difficulty digesting certain types of food. Additionally, more than half of the children with Down syndrome also suffer from vision problems including cataracts, cross eyes, involuntary eye movements, and nearsightedness. Unfortunately, about three-fourths of the children may develop hearing loss from structural issues in their ears. Additionally, since Down syndrome causes problems in the immune system, they are more likely to be infected by bacteria and viruses very easily. Finally, they are also prone to inheriting a series of hazardous blood disorders, some of which include anemia and leukemia. Lastly, other diseases are conditions that this syndrome generates are disrupted sleep patterns, hypotonia, which is poor muscle tone and low strength, and problems in their upper level spine. For Down syndrome will depend on each individual. However, all of them do require a group of specialists to help them overcome their intellectual and physical disabilities and motivate and encourage them to be better and improve themselves. Early intervention and occupational therapy are also very useful. Other types of treatment therapies include physical, language, occupational, emotional, behavioral, and Other drugs or supplements are also used to help them and aid them through their development. With the increase in awareness, inclusion, and technological and medical advances, they have managed to increase their quality of life substantially. Today, with the many advancements in heart surgery treatments, people with this disorder are much more likely to reach the age of 60 or even older. People with Down syndrome are not only well-rounded individuals, but also excel in different aspects such as sports, law, and science. There are even special Olympics hosted every 2 years for people with intellectual and physical disabilities to compete. This helps the Down syndrome community to be initiative, motivated, and happier. In May 5th, 2013, Karen Gaffney, a 36-year-old, graduated from Oregon University of Portland and the first person with Down syndrome to obtain a doctorate degree. Once again, proving that quality of life of a person with Down syndrome is vastly better from someone with this condition a couple of decades ago. Thankfully, as the National Down Syndrome Society states, individuals with Down syndrome are becoming increasingly integrated into society and community organizations, such as school, healthcare systems, workforce, and social and recreational activities. However, society and businesses are also raising awareness of this condition and are constantly making incentives to increase their acceptance and integration in communities. Some children with this condition are even able to attend a normal elementary and high school with people who don't have their same intellectual disabilities. Ultimately, society has also declared March 21st as the World Down Syndrome Day, and October as the Down Syndrome Month. Finally, there are also a lot of supportive organizations such as the National Down Syndrome Society, the European Down Syndrome Association, the National Down Syndrome Congress, and the Global Down Syndrome Foundation that are also improving their integration in society. All organizations and commemorations increase their support, appreciation, and inclusion of the Down syndrome community in the world. Thank you so much for your attention, and I hope this serves as a useful resource to learn more about this interesting genetic disorder.